Good afternoon and welcome to Downing Street for today's coronavirus press briefing. I'm joined by our National Medical Director for the NHS, Professor Steve Powis, and Professor of Public Health and Epidemiology at Manchester, Professor John Newton. Our step-by-step action plan is aiming to slow the spread of the virus so fewer people need hospital treatment at any one time, protecting the NHS's ability to cope. At each point, we've been following scientific and medical advice, and we've been deliberate in our actions, taking the right steps at the right time. We're also taking unprecedented action to increase NHS capacity by dramatically expanding the numbers of beds, of key staff, and life-saving equipment to the front line, to give people the care they need when they need it most. I've been away for a week now, and I'm delighted to be back. In the past week, we've completed the construction of a whole new hospital, the NHS Nightingale Hospital in London, built in 9 days. With 4,000 beds, this is the equivalent of 10 district general hospitals. And there's more to come in Birmingham, Manchester, and Glasgow, where the military have been working wonders in helping to construct. This has been an incredible achievement, and I want to thank everybody involved. I also want to thank everyone who has followed the social distancing guidelines and the admirable fortitude and spirit of the British people in following these rules. And Steve will update us on the progress that's being made and how people are following those rules. And I want to pay a huge tribute to all of the councils, the primary care, community care, pharmacies, and unbelievable 750,000 volunteers who've signed up for shielding the most vulnerable. This is Britain at its best. Sadly, the coronavirus continues to grow. I can report that through the government's ongoing monitoring and testing programme, that according to the latest figures, 163,194 people have now been tested for the virus. 33,718 have tested positive. And the best scientific analysis is that the rate of infection has been doubling every 3 to 4 days. The number of people admitted to hospital with coronavirus symptoms is now 12,949. Of those who've contracted the virus, 2,921 have sadly died. We express our deepest condolences to the families and to the friends of the victims. If the past few weeks have shown us anything, it's that we are steadfast as a country in our resolve to defeat this invisible killer. I'm profoundly moved by the compassion and the commitment that we're seeing from people right across the country. And in the health and care system, we've lost colleagues too. Doctors, nurses, mental health professionals, they have paid the ultimate price for their service, working to care for others. And I just want to say this on behalf of all my colleagues in health and social care. I am awed by the dedication of colleagues on the front line, every single person who contributes to the running of this diverse and caring institution that our nation holds so dear. Many of those who've died, who are from the NHS, were people who came to this country to make a difference, and they did, and they've given their lives in sacrifice, and we salute them. And I tell you this, I come back redoubled in my determination to fight this virus with everything I've got, and we will strain every sinew to defeat it once and for all. And I'll stop at nothing to make sure that frontline staff have the right equipment so that they're safe and can have the confidence they need to do their jobs. And I know that people have been asking questions about protective equipment. With the support of the British military, we've shipped a record quantity of equipment to the front line. Just yesterday, 45 million pieces of protective equipment were delivered across health and social care, including more than 5 million aprons and 6 million surgical masks. Today, Public Health England have announced the upgraded PPE standards that people should use and expect. The upgraded guidance has been developed through intense consultation with stakeholders right across the board and staff on the front line. We have listened, we've put the interests of health and care staff first and put them at the heart of this. The new guidance recommends the appropriate level of PPE to protect people in all circumstances. These standards are amongst the highest in the world and in line with the recommendations of the World Health Organization. I'm delighted they've been welcomed by the Medical Royal Colleges, the BMA, the Royal College of Nurses, and the trade unions. Any health or care organisation that needs PPE should call the hotline so that our military operation for delivering PPE can get that protective equipment to you. These are unprecedented times for our health and care system, and I want to make sure that every part of it is supported. I've therefore made £300 million available for funding for community pharmacies, who do so much to get vital medicines to people and play such an important part in their communities. They themselves are the NHS frontline. And today, to help NHS trusts to deliver what's needed without worrying about past finances, I can announce that I'm writing off £13.4 billion of historic NHS debt. This landmark step will not only put the NHS in a stronger position to be able to respond to this global coronavirus pandemic, but it will ensure that our NHS has stronger foundations for the future too. But this is only one part of the picture. I quite understand too why people are yearning for the certainty that good testing provides. I get it. Public Health England can be incredibly proud of the world-beating work they've done so far on testing. The rollout of Public Health England's COVID-19 diagnostic test is the fastest deployment of a novel test in recent history, including faster than the swine flu pandemic in 2009. But I'm going to level with you about the challenges that we face and the plan we have to rise to those challenges. I'm going to go through some of the challenges in very specific detail and then talk about the plan we have to drive this forward with a significant increase in testing. First of all, unlike some countries, we didn't go into this crisis with a huge diagnostics industry. We have the best scientific labs in the world, but we did not have the scale. My German counterpart, for instance, could call upon 100 test labs ready and waiting when the crisis struck, thanks in large part to Roche, one of the biggest diagnostic companies in the world. We have had to build from a lower base. Next, there's the demand for materials. There's been a shortage of both swabs and reagents. Thanks to the ingenuity of my team, we have fixed the swabs issue, and we're tackling the shortage of reagents. We're resolving this reagents issue, but as the head of Roche and the President of the United States have commented, this is a global challenge. I'm sure that we'll get there. Next, there's the challenge of prioritization. Look, I understand why NHS staff want tests so they can get back to the front line. Of course I do. But I took the decision that the first priority has to be the patients for whom the result of a test could be the difference in treatment that is the difference between life and death. I believe anybody in my shoes would have taken the same decision. I'm proud that every single patient who's needed a test for life-saving treatment has had access to a test. But of course, NHS staff need access to testing too. And I'm delighted that at the weekend we could roll out this access for the first time. And there's a challenge too of making sure that the public can have confidence in tests. Several of the tests that we're currently checking have failed. In one case, a test that I'm being urged to buy missed 3 out of 4 positive cases of coronavirus. That means in 3/4 of cases, that test would have given the false comfort of sending someone with coronavirus back on the wards. Approving tests that don't work is dangerous, and I will not do it. Now, these are some of the challenges that we've faced, but I want to set out my plan to boost testing. Let's first be clear about the goal. Always to ensure that testing is available to patients who need it. Next, to expand testing to critical NHS staff and their families. And I can announce today that we're expanding testing for NHS staff further. Third, as we ramp up the numbers, we'll test critical key workers, and over time, we'll expand testing to the community. Our ultimate goal is that anyone who needs a test should have one. Now, let me take a moment to set out my 5-pillar testing strategy to achieve these goals. The first pillar is swab testing in Public Health England labs and within the NHS in their hospitals. This is the testing to find out if you currently have the virus. We've already reached a target of 10,000 tests per day, precisely on time, by the end of March, as committed. And we're committed to reaching 25,000 tests per day by the end of April at the latest. Because it allows the NHS to identify and effectively care for those who are most seriously ill, saving lives by helping clinicians decide the most effective treatment options, I can reassure you that every single patient who needs a test is able to have one, and this is how we're going to make sure that people get the right treatment in hospitals. The second pillar is the creation of a brand new swab testing capacity delivered by commercial partners. Again, this is swab testing to tell if people have the virus. The biggest part of Pillar 2 is partnerships with universities, research institutes and companies like Amazon and Boots to build from scratch a network of new labs and testing sites across the country. This brand new service has just launched and is ramping up rapidly. The trials of this have successfully completed, and the number of tests at this facility will significantly increase from this weekend. To begin with, this capacity will be used solely for frontline NHS staff and their families. Increasing testing capacity for NHS staff will allow more doctors and nurses who do not have the disease safely to go back to work and to treat those who are most in need of care. These are currently in the final stages of development. As of now, over 5,000 NHS workers have been tested across the 5 new testing sites and these testing capabilities. Currently, there are only 5.7% of doctors absent due to COVID-19, but of course we want to get that number down. And we're working with other testing companies to expand Pillar 2, so over time we have many different commercial partners delivering mass swab testing. The third pillar is blood tests. Now, blood tests are designed to tell whether people have had the virus and are now immune. These tests are done by taking a blood sample and looking for the presence of the right COVID-19 antibodies. These could potentially be done at home with a finger prick and deliver results in as little as 20 minutes. We're currently working with 9 companies who've offered these tests and evaluating their effectiveness. These antibody tests, blood tests, offer the hope that people who think they've had the disease will know they're immune and can get back to life as much as possible as normal. But they've got to work. The fourth pillar is surveillance. We're conducting some of the biggest surveys in the world to find out what proportion of the population already have the virus. This is done using an ultra-high accuracy antibody test operated by Public Health England at their Porton Down Science campus. We have capacity for 3,500 of these tests a week, enough for population sampling to begin with. Robust population surveillance programs are essential to understanding the rate of infection and how the virus is spreading across the country. We'll use these tests to help us strengthen our scientific understanding and inform us on the big choices that we have to make about social distancing and how we exit from this crisis. We did not start this crisis with a large diagnostics industry, but that doesn't mean that we can't build one. Just as our top-end manufacturers have joined up the national effort to build ventilators, so the pharmaceutical companies will do the same for testing. Our pharmaceutical giants like AstraZeneca and GSK which have no great history in diagnostics, are now working with our world-leading but small diagnostics companies to build a British diagnostics industry at scale. The new national effort for testing will ensure that we can get tests for everyone who needs them. And I'm delighted that the pharmaceutical industry is rising to this challenge and putting unprecedented resources into testing. Taken together, I am now setting the goal of 100,000 tests per day by the end of this month. That is the goal, and I am determined that we will get there. And to help drive this work forward, I'm pleased that Professor John Newton from Public Health England will be taking on a new role to coordinate this national effort for testing, working with my brilliant departmental officials, the NHS, and the life sciences industry. Professor Newton is widely recognised as a leading voice on public health and epidemiology, and I'm thrilled that we can bring to bear his considerable experience on this vital issue. My 5 pillars represent a comprehensive plan to put in place the testing that is mission critical as we fight this battle against coronavirus. There will be problems, like many of those that we've already overcome. After all, building a brand new industry, it's not easy. There will be bumps in the road and criticisms made, and some of them will be justified. And I return from illness more determined than ever to fight this disease. We'll bring together the best minds, we'll bring together the best science that this country has to offer, and we'll work with our friends and allies from around the world as we do so, because we are in the midst of a war against an invisible enemy, and it is a war in which all of humanity is on the same side. And history's shown that when the world unites against a common foe, then we will prevail. As the Prime Minister said yesterday, mass testing is how we unlock the coronavirus puzzle and defeat it in the end. But in the meantime, while the disease is still spreading and the government builds up its ability to test at mass scale, the most important thing for people to do is to stay at home, to protect the NHS, and to save lives. Now I'm going to turn to Steve Powis, who's going to set out some of the details of where we're up to in our fight against coronavirus. Steve.
Thank you, Matt. I'd like to update you with some of the information that we have been collecting that tells us how we are doing in our efforts to combat this virus, as the Secretary of State has outlined. You will be familiar with some of these charts. We have shown them before, but they are updated to show you the current position. So as everybody knows, the key thing in battling this virus is to reduce our contact with others, social distancing. And by doing that, we reduce the chance that the virus is transmitted from one person to another. We reduce the spread of the virus. And if we do that successfully, then the number of cases start to reduce. So this first chart gives an update on how we're doing as a nation in reducing that social contact. And this, as we said before, takes information from our transport services, although we do have data from many other areas of life, which shows very similar data. And this shows that we continue to see a large reduction in the usage of public transport, which is a good thing and reflects the compliance that we all have with the instructions we've been given. Unfortunately, motor vehicle usage went up a couple of days ago, but it's not gone up any further, and personally I would like to see that come down a bit more. In the next slide, we begin to show how that translates into infections and hospital admissions. Now, as I and others have said previously, it will take some weeks for all the efforts that we are making to reap benefit and to start to translate into a reduction in infections and a reduction in hospitalizations. And so you can see that we are still seeing an increase in infections, although I think it's important to say, as I've said before, not to take any single day and to look at a trend over time. In the next slide, this shows how it's translating into hospital admissions. Again, it's worth pointing out that London is ahead of the rest of the country and has seen more pressure. but you will also see that other areas in the country are now seeing pressure, such as the Midlands. You'll also see, though, that this curve or this line is not getting steeper and steeper as time goes on, and that is a good thing because it means that there is a constant level of increase, and there is some indication that going forward we might start to see it flatten off. But as I've said, this will take a week or two because there is a lag period between getting an infection and being hospitalised a week or 10 days later. And then finally, of course, that translates unfortunately and with great sadness into deaths. And we are still seeing the number of deaths increase. And as I've said, unfortunately, I think that will continue to be the case. We will still see those higher number of deaths for a few weeks yet until the benefit of all the actions that everybody in the country is taking will start to bear fruit and will start to impact into a reduction in deaths.
Thanks, Steve. So if we now go to questions. First question from Laura Koonsberg at the BBC.
Thank you very much, Secretary of State. You've just announced a big new target for the end of the month, but can I be clear that that would be of all kinds of tests? So the antibody test, as well as the test to say if people have got the disease right now. Can you give us a firm date by when any NHS staff that needs a test will get a test? Because in a fast-moving crisis like this, the end of the month is still a long time away.
Yes, thanks, Laura. The new goal of 100,000 tests a day by the end of this month is over all 5 pillars. Now, if one of the large-scale antibody tests that we're working on and testing comes good, then of course that will be great news. But we will not, as I said in my remarks, we will not be allowing one of those to proceed until we are confident that it is a good test, because no test is better than a bad test. So the 100,000 a day is across all 5 pillars, and I'm calling on the life sciences industry, the universities, and of course the public agencies that report to me, the NHS and Public Health England, to unite together to meet that goal. You ask about testing of NHS staff. Now, this is incredibly important, as I said. I'm delighted that we've now managed to test 5,000 NHS staff, and I'm also delighted that the absence figures, the number of people who aren't at work in the NHS due to coronavirus, is lower than had been previously reported. And I will, over the coming weeks, seek to ensure that every NHS frontline staff member who needs a test gets one, and crucially, their families. Because sometimes some NHS staff have to stay at home because of they're following the rules on household isolation if one of their family gets the test. I set out why we prioritise patients first. The next prioritisation is, of course, NHS staff working in critical care, and then after that we will spread the availability of tests across the NHS and social care, and then other key workers, and then over time to the population as a whole. I don't know if John, you want to add something on testing.
Yeah, thank you, Secretary of State. Well, the initial priority, of course, is for the swab tests, because those are the tests which allow the NHS to manage critically ill patients to the best they possibly can, and also to allow NHS staff and other key workers to come back to work when they can. The antibody tests are ideally done 28 days after an infection. So, in fact, the requirement for the antibody test isn't really with us yet. So the urgent priority, both types of tests are important, both are urgent, but the most urgent is the swab tests so that we can treat patients better and get staff back to work.
Fantastic. Did you want to come back on that, Laura, or?
I think, Secretary of State, we asked if there was a firm date that you could give NHS staff who need tests. You just said over the coming weeks.
Yes.
Would you put a date on that? Would you give it a deadline? Because people are very worried about this right now.
Well, they are, and I'm glad that we're able to speed it up. It will absolutely be before the end of the month, but we are, and I'm saying over the coming weeks, with 5,000 tested since this started. At the weekend, we've clearly made significant progress, And I'm really glad that the figures of those in the NHS who are absent due to coronavirus are lower than had been previously reported. But we will get there as soon as we can. And I'm absolutely determined to make commitments that we can meet rather than to overpromise. And that's one of the reasons I've set out some of the difficulties and the challenges that we're facing, which we're trying to overcome in testing.
Laura, it's probably also important to emphasise from the NHS perspective the staff that we most want to test. And this is what has been reflected back to us from NHS organisations too. So, of course, as Secretary of State has said, the staff in key areas such as critical care are very important. But it's the staff at home who are in household quarantine. They are well, but a member of the family is unwell. Those are the staff that we want to prioritise first. And of course, as you've heard, that involves testing the person in the household who's unwell, not the member of staff. There are staff, of course, who are self-isolating because they're symptomatic. They're important too. But of course, if they're unwell, actually what we want to make sure is that they get better. We have a duty of care to our own staff. And if they're at home sick, then it's really important that they get better before they come back to work.
Thanks very much. Next question from Robert Peston, ITV.
Hello. Professor Powers, I think you talked comparatively recently about green shoots, but if we look at the charts that you've presented today, you've got a logarithmic scale for deaths rising in a straight line, still out of control. We've had a big leap in reported new cases. Have those green shoots vanished? And then secondly, a lot of attention has been paid to the shortage of protective equipment, PPE gear for medical and frontline staff, which the Secretary of State has talked about how you're trying to correct. But lots of hospitals are reporting unease that they may run out of oxygen, sedatives, anaesthetic. What system do you have in place to make sure that other absolutely vital consumables, as I understand you call them, don't run out?
Well, if I answer the second part of that question, then cast over for the first, we have a very detailed plan for making sure that we have the full supply of medicines, including ones that you mentioned, sedatives, and all the medicines needed for those who have COVID-19 and people being ventilated. We probably have one of the strongest understandings of the supply chain of anywhere in the world because of the preparations we did for a no-deal Brexit, and we keep them constantly under review. In fact, I took a meeting on this question today. So whilst we, of course, with the lockdowns around the world, we are highly vigilant, we are currently confident that we have the supplies of medicines that are needed.
So no, I still think there are reasons to be hopeful. As I said a couple of days ago, one of the very first reasons for that is because we do see, as I have shown you, that the public is complying with the measures that the government have laid out to reduce social contact and to stop the spread of the transmission. If we didn't see that happening, then I think the answer would be no, but we do see that happening, and it's important we continue to see that happening. Secondly, as Sir Patrick Vallance said earlier in the week, we do see early academic evidence that the transmission rate in the community may have fallen below 1. And that's important because if it's the case that we are no longer passing the virus on to multiple people, so to less than one person for everybody who's infected, then that is additional evidence that infections are going to reduce. But as I've said before, and as I said a few minutes ago, it does take time for that to translate into changes in hospitalisation, infection rates, hospitalisation and death. So it is still too early. Yes, reasons to be hopeful, but reasons not to be complacent and reasons to continue for everybody to comply with those measures.
Just in case you didn't know, stay at home, protect the NHS, and save lives. Still absolutely vital core messages. I think you're trying to come back, Robert.
Yep.
Yeah, it was just, I mean, obviously it would be incredibly encouraging if the rate of transmission, the R as you call it, is below 1. But how do we know? What sort of evidence are we gathering that gives us that kind of information and perhaps confidence?
Steve.
So it's possible to gather that some of the information by looking at the way that people interact with each other. So it is possible from a modelling perspective to make assumptions based on the amount of contact that we can see is going on with each other. It is absolutely the case that to be sure of that, the sort of studies in the community that the Secretary of State has highlighted will confirm that. Which is why there's reasons to be optimistic about it, but not reasons to be absolutely certain about it. And that's exactly why I said that it's too early to tell yet. But the good news is that people are complying with staying at home, with avoiding contact. And some of our very, very early evidence is that that should start to translate through to fewer hospitalisations, less pressure on the NHS and fewer deaths.
Thanks very much. Victoria MacDonald at Channel 4. Hi.
Thank you, Mr. Hancock, and welcome back. I just wanted to ask a question about you yourself were tested for COVID-19, and I wondered under which criteria you were tested. And given that the general public is still some way away from having their own tests, you say 100,000 a day by the end of the month, but that's not 100,000 people because of all the false negatives. So can you just tell us why you got the test?
OK, we're going to leave that to number 10 news briefing. The 6 o'clock news with all the day's developments on the coronavirus pandemic is coming up. But first, the weather news. And here's Thomas Schaffenacker.
Hello. Across most of the UK, the weather's relatively quiet at the moment. Quite windy in northern parts of Scotland, though, particularly the Northern Isles. Now, notice that the winds are blowing out of the north or the northwest. Skies are also clearing across parts of Scotland through this evening and overnight, and also the north of England. So certainly a frost on the way, air frost. You can see temperatures below freezing there, but probably a little bit too cloudy across the south here. Temperatures early on Friday around 6 or 7 degrees. So here's Friday's weather forecast. A few showers carried on a northwesterly breeze, probably the best of any brightness maybe around some of these eastern and southern areas, but there will be a fair bit of cloud actually around during the day. A cool day, particularly in the north, 8 degrees. In the south, we'll get up to around 12 or so. Saturday will be quite a cool day, but come Sunday, those temperatures are expected to skyrocket across the country, possibly hitting 20 degrees.